Hey everyone, Dr. John Schaefer here. Today's presentation is taking control of your knee pain, why traditional treatments fail, and what really works. I'm a doctor of physical therapy. I'm board certified in orthopedics. I'm also a certified strength conditioning coach through the NSCA. You'll hear a little bit more about my story as we go along, but really the goal of this presentation is to help you take control of your current situation. Whether you've been dealing with knee pain for a week, whether this has been going on for years, either way, I know and I trust that you're going to find some good value through this presentation, and either be able to take action on your own or have additional follow-up questions. You can have better conversations with your providers and have a better understanding of where you fall in the overall spectrum of knee pain, because no one case is exactly the same as others. So I'll help you better understand what's going on with your knees, why you're having pain, and why the system might be failing you. So, overview, we'll talk a little bit about my story, how I ended up where I am, why traditional treatments don't always work. So, you'll have a better understanding of maybe you've tried a lot of different things but aren't seeing progress. You'll have a little bit more insight into why that might be. We'll talk about how to assess your own knee pain. So, I'll give you some different tests that you can do in your house, or on your own without the need for a provider, so you can better understand where some of those limitations might fall. I'll also talk about some common causes of knee pain. So understanding, what structures might be involved, and, is it important to identify those structures, or is it more important to look at function? We'll have a little bit of a conversation about that. And then finally, we'll talk about the active treatment process. I'll walk you through how I would address an individual with knee pain, what kind of steps to take, things along those lines. And if you have any questions as we go, just drop them in the comments, and I'm more than happy. I'll check back on this video and answer them as we go as well. So let's start by talking a little bit, I'll move myself down here, talking a little bit about my story. I have had an extensive injury history. So I broke my leg, wrist, collarbone, had a stress fracture in my foot, surgery on my back, surgery on my knees. And so growing up, I always felt like there was something wrong with me. It was one injury after another after another. I saw all types of providers. I saw physical therapists, in all sorts of different settings, saw different doctors, different chiropractors, you name it. And a lot of those providers gave me some good things to think about. Some of them did a really nice job explaining and empowering my situation. Others I felt like were a little bit dismissive and maybe didn't take the time to look into the root cause of why I was having some of these issues. But really, my experiences, both bad and good, with these providers shaped the type of provider that I want to be. So I had finally met some providers that really empowered me to take control of my situation, explain my options, explain the root cause, and most importantly, installed hope in a future for me where I was going to be able to live pain free and do all the things that I wanted to do. And that was super important to me because that instilled a new sense of life in me. Because for a long time, I questioned, what's this future going to look like if I'm having all these injuries at such a young age? Is this what it's going to be for the foreseeable future, for the rest of my life? So having people that you can have conversations with and understand, why you're experiencing the things that you are, and also come up with a game plan to point you in the right direction. So this really, all these injuries led me to choose PT as a profession. I wanted to be that provider for others, that I received myself when I had those positive experiences. And then following graduation from PT school, I completed a strength conditioning internship, at Champion PT and Performance. So this was a facility where we're working with high school, college, pro, Olympic athletes. People performing at the highest level had access to all kinds of awesome technology, really all the resources you could ever want. And I was there for probably 3 or 4 months. And then once that finished, I moved to Houston, Texas, and I worked at Harris Health Systems, which is the safety net hospital system throughout Houston. So there I was working with uninsured patients, Spanish speaking patients, patients who really didn't have a whole lot. So between those two experiences, I've been able to see and treat people at all ends of the spectrum. So individuals who have every resource you could imagine, access to the greatest technology on one side, and then on the other side, people with very limited resources. Yeah, and then so this kind of comes down to my treatment philosophy too, that no matter where you're at currently in terms of your health and wellness, no matter what resources you have, you can improve your condition, you can get out of pain, you can get back to doing the things you love. So my treatment philosophy then is really geared towards educating patients on where they're at currently. I'm giving them a roadmap to where they're going to end up and how they're going to get there, as well as giving them support, breaking down movements that are challenging, and making sure that, we're able to gradually build up those movements that are challenging. Oops. So let's talk a little bit about why traditional treatments don't always work. We'll start by talking about three different myths, three different kind of areas that are emphasized a lot, but are maybe hurting patients more than they're helping. And the first is the rest and ice trap. So whenever we get injured, the first thing that typically comes to our mind is, okay, I got to take some time off, or I got to rest. I got to just take a little break, put some ice on it. But the problem with this is people get trapped in a cycle where maybe they rest for a little bit or ice for a little bit, 2, 3 days, then try and jump right back into activity without doing anything else. And then those symptoms come back. And it's a cycle because you rest, you ice, you get back too quickly, and then you're back resting and icing again. And around it goes without seeing any improvement because you didn't give your body a chance to adapt those injured tissues. The next is the surgery myth. So in these situations, if you experience an injury, you might go straight to an orthopedic doctor and think, oh my God, I've been, having this pain for a while. Surely I need X, Y, or Z surgery. Without exploring any other options, the first thing that comes to your mind is I'm broken and I need to be fixed with surgery. Nothing else will help. And that's a very dangerous mindset because if you think that surgery is going to fix everything and there's no other options, you're not even going to try some of those more conservative measures that could help you avoid going underneath the knife altogether. The last myth or common type of treatment that doesn't always work are medications, so taking pills, as well as cortisone injections. Both of these really act as band-aids, so they provide temporary relief. In the case of medication, maybe you started taking 2, 3 pills at a time. Maybe it was just one. But over time, your body starts to adapt and build up a tolerance to where if you started taking one pill, now it takes 3, 4 just to see that same difference in your symptoms. So we don't want to get in a cycle where we're relying on medication and medication becomes our baseline. The next is cortisone injections. People will often tell me, I just need an injection and then that will help with my symptoms and I can get back to doing the things I want. Well, if you're only relying on injections and you're not building strength around the joint that's having irritation, the joint that's having issues, you're not helping yourself in any way. It's going to be a situation where you get a cortisone shot, your symptoms improve a little bit, you continue to do the things you've been doing, pain comes back, and then you get another cortisone shot, symptoms go away temporarily. So what's most helpful when it comes to cortisone injections is setting yourself up for success. So when you have less symptoms following that injection, you start to work on strengthening and things like that, so that you don't need to continually rely on injections because there are a lot of risks with injections if you're constantly getting them. Typically, the most you would ever want to have within a 12-month span is 2, maybe 3. We can talk about some more of those risks later on as well. So this funnels nicely into the old medical model versus the new medical model. So I'm going to walk you through exactly what's going to happen if you do decide to see your orthopedic doctor, say for knee pain. So you'd schedule an appointment with either your ortho doctor or your primary care physician. And the ortho doctor would do an assessment, likely order some kind of images. The images will come back. They could give you some information, but it's super, super important to note that imaging is not always super useful or even reflective of where you're at. Too many times I've seen people who their images have showed they've got severe arthritis, they're in terrible shape, but they don't have any symptoms. They don't have any issues at all that would indicate they need a surgery. They're not having pain. They're doing everything they want to do. And then we also see a lot of patients who are having terrible symptoms. They're in so much pain. They don't know why, and their images look fine. So we have to always take the images with a grain of salt. It can't be the only thing that you rely on when making some of these decisions with the help of your provider. So if you do get the images, they come back, they likely show some sort of bony changes. Your doctor might say you're bone on bone, depending on how conservative or how aggressive they are. Some doctors might say everyone's bone on bone. But the ortho doctor then might try to offer some cortisone injections as a first line of defense. We talked a little bit about this earlier. Yes, that can help with your symptoms, but if you're not doing anything else, you're simply putting a band-aid on it, and you're likely going to be back in their office in a couple months getting more injections. So you get the injections, they might provide relief for a few weeks to months, and then you could, potentially return back to that doctor still having discomfort. So after that, the ortho doctor might continue to offer conservative care. At this point, they may even prescribe physical therapy. Following physical therapy, the patient might see improvement with therapy, or they could return to the doctor after giving it a trial of 6 to 8 weeks. And then if that fails or doesn't work out to how the patient wants, the ortho doctor may offer surgical intervention. The new medical model takes a new spin on things where you can skip several of these steps. You can skip the first 6 steps. And you can go right to a physical therapist without a doctor's referral in many states. So going to a physical therapist, see what they offer, see what they have to say, try several sessions. And then if you're not seeing the results you want, then you can go down this whole pipeline. They can refer you to an orthopedic doctor. You can get those images, you can get those injections. And oftentimes, if you want to get the injections, you can continue therapy, build that strength, and then maybe you don't need a second round of injections. So utilize the skill set of physical therapists, and that can be extremely beneficial in saving time, saving money, and you don't have to go through this whole step this whole sequence if you don't necessarily want surgery. So I always tell my patients or friends, family, people who are considering seeing an orthopedic doctor, see a physical therapist first, get their opinion. And if they think it's something they can help you with, they'll tell you. And if they don't, they'll refer you to an orthopedic doctor. It makes things a lot easier for you. And like I said, it can save you a lot of time and money. And then let's talk next about, so if you do see a physical therapist, that is going to be much more geared towards taking active approach, using active treatments. And that's always what we want to see following an injury, because there's a lot of people who are in this mindset of seeking more passive treatment. So I want to cover the difference between the two, and how you can apply this to yourself if you're recently injured. So following an injury, if you are taking a more passive approach, you might decide, okay, I'm stopping all activities. I'm going to pray to God it's only a minor injury. I'll wait, I'll see if the body maybe heals itself. Try taking medication, maybe use ice or heat. And then if no progress after, I don't know, a week or so, you start to consult the provider or think, oh, maybe this is more serious. The active approach, on the other hand, completely empowers you to take control of the situation. So active treatments include continuing to move your body in ways that are comfortable, gradually stressing the injured area, the injured tissues over time through targeted exercise, gradually increasing that motion, and then adding on resistance. During this time, also thinking about, okay, what can you do sleep-wise? Are you getting 7, 8 hours of sleep at night? What can you do with your nutrition? Are you eating well? If you're not seeing progress after trying all these things, continuing to stay active, then consult the provider. There's 2 big differences. With passive treatments, you're waiting, you're hoping, you're thinking, oh, let's see if the body takes care of itself. Active treatments, you are in control. You are saying, I'm going to guide this rehab process. I'm going to let my body do what it can, and I'm going to continue to advance. So next, let's get into assessing your own knee pain. So we have to understand the different signs and symptoms where it is important to see a provider. And then I'll show you a couple at-home movement tests, a self-assessment you can do. And then we'll talk about why it's important to understand your pain. So some signs where it might be beneficial to seek an additional opinion would be persistent pain. This is pain that hasn't gone away for several months. If there's ongoing swelling or instability, that can point sometimes to ligament damage, things like that, that we might be more concerned about potentially needing an operation. If you're starting to have difficulty with daily tasks, if those things that once felt easy, felt like a piece of cake, are now extremely taxing, that's also a concern. If you're having recurring pain after activity, this means you're doing the things you love or the things you need to do, and you're having pain every single time you complete these tasks. Probably a good idea to get a second opinion. Lastly, if you're noticing decreased range of motion, you can't bend or straighten your knee, you're walking funny, all those signs and symptoms are reasons that you might want to consult with someone. I'll go through some of these movement tests on the next slide here, and I'll show you exactly how to do them. But I want you to understand the value of understanding your pain. If you know what things you can't do, what issues you're having, you can communicate that with the provider and they'll be able to help you a little bit more. If you're going into a provider's office, they're not putting their hands on you, they're not taking you through different tests, different movement assessments, that's a little bit of a red flag. If I'm having someone suggest an operation, a procedure, I want them to know exactly what's going on and I want them to be able to explore other options. I don't want them to just see an image and say, well, I guess you need surgery. So understand what kind of assessment, what kind of communication you're having with these providers. The more you understand your own body, the better you'll be able to contribute to some conversations regarding the pain you're experiencing. So with this at-home self-assessment, these are going to look at your range of motion. This is going to look at your stability, and this will also look at just some of your body mechanics. So first part of the assessment is just heel slides. You can use a towel, you can use a dog leash, you can use a belt, anything to wrap around your knee. And all you're going to do is bend your knee up as far as you can and just see what that motion looks and feels like. Do you have stiffness in the front of the joint, behind the joint? Are there are there pain points halfway through? Are there pain points at the end of the motion while you're bending, the end of the motion with extension or straightening? So take a look at that. Normal range of motion is 0 to 120 degrees, meaning you should be able to get your heel about 1 foot length from your butt, your hips. If you can't, there's ways we can work on that. The next is the mini squat. So standing up, you're just going to squat down and then stand back up. Pay attention to your knee tracking. So you notice we've got B here, the knees are caving in a little bit. A, the knees are going out. So just pay attention to, how wide your feet are in a comfortable squat, what your knees are doing. And this can just give us a little bit more information about your body and as well as your body mechanics. Sometimes when the knees cave in, that can point to things like hip weakness, not always, but just something to think about. And then the last part of the home assessment here is a single leg stance. So just standing on one leg, marching your other leg up. This can tell us a little bit about your ability to control the knee in a single leg position. Like for instance, is it painful to take weight through your knee when you're standing on one? Is your knee diving in or going out? So that can point to just a little bit more in terms of stability. Now the fun part. So common causes of knee pain. Put me down here. Okay, so you've likely heard some of these different terms down here. So you've heard about meniscus tears, ligament damage, like ACL, MCL, IT band pain, hamstring injuries, Baker cysts, and the list goes on. So these are all the conditions that we commonly might hear about as we're talking about knee pain. But the question then becomes, does it really matter? So all of these different conditions are caused by one of these 5 things up here. So muscle imbalances and weakness, poor movement patterns, overuse injuries, old injuries that maybe didn't heal up as well as we would have liked. And then all these are important to know, like what location to help us better identify structures. But it's important to note, like no matter what's going on at the knee, yeah, we can pinpoint structures sometimes. But in every single case, we'll be able to identify, are there certain areas where you're a little bit weaker? Are there movement patterns that aren't occurring as they're supposed to? And all those pieces are things that we can change, things that we can improve to improve your overall condition. So it's always important to look beyond just identifying, specific structures. It's getting to the root cause and understanding why did this happen in the first place. So when it comes to location, the reason I included that here is because if you're having pain in certain areas of your knee, it can give us a lot of insight into what might be going on. So if we look on the outside of your knee here, this could be a lateral collateral ligament injury, lateral meniscus might be involved, your IT band runs along the outside. and can be a contributing factor. Pain or instability on the inside, we've got medial collateral ligament, medial meniscus, and then any kind of instability. We always are thinking about meniscus, um, ACL and PCL run through the middle. We don't need to go super in depth into all the different anatomy here, but understanding where you have your pain can make a big difference um, in identifying those structures, but also it's not the end all be all. So the more you can describe your pain to your provider, the better aware you are of the position of your pain. All that makes a big difference in your communication with those practitioners, and they can just better help you. If you know what you're feeling, what you're experiencing, your provider will be able to help too. So let's talk a little bit then about the pain-free performance plan. So this integrates things like the active treatment process over the passive treatment process. This talks about how to continue moving forward, things like that. So let's just walk through an example here. So let's say all of a sudden you have knee pain, you tweaked your knee. All of a sudden, so you're in step one. The first thing you do is you take a little bit of time off. You start icing. Maybe you're seeing some improvement. After maybe a day or two, you decide, okay, I'm going to get back to playing soccer. Your knee flares up. So all of a sudden you're at step two, and then you find yourself moving through a setback, and then you're back at step one. Your knee's flared up. It's sore again. Try icing, try rest, maybe take some medications. Huh, feeling pretty good again. Now you're at step two. Okay, let's go out and try a little bit of jogging. Now you're back at a setback and you're back at step one. You can't quite figure out what's going on. You're asking yourself, okay, do I need to see a provider? Why isn't this thing getting better? You're getting frustrated, and it's not a good place to be at. This is how people start to fall down into the medical system of seeing an orthopedic surgeon potentially earlier than they need to. Let's take a look at a different approach here. You hurt your knee, take a couple days off. Maybe you ice for a little while, calm down that initial inflammation. Then you get to step two. You start to strengthen some of those muscles around the knee. You work on your quad strength, you work on your hip strength. You start to strengthen some of those movement patterns, maybe even the one that you injured yourself in. And then things continue to improve. You're a little bit stronger at this point. Once we're at step three, you're conditioning your body. If you're a soccer player, maybe at this point, on top of your strengthening, you're getting back to doing a little bit of running. If you are someone who is just having discomfort with walking, maybe we start a walking program. Whatever it is that you're eventually trying to get back to, we'll start to incorporate those pieces during step three as you're starting to feel better, as you've already addressed those deficits. And then once we get to step four, we're making sure you're in a position where this does not happen again. We're making sure that your body is strong, you're able to perform all the tasks that you need to, and you're in a really good position. But the key with all of this is you're actively, slowly taking your time, following a guide, following a specific plan to build up your strength, address any of those deficits, and then gradually work in some of those activities, rather than just resting, hoping things get better, and then jumping right back in. But most people find themselves stuck between steps one and two as they try and problem solve by themselves. And this might look like watching random YouTube videos, looking for exercises on your phone, or not doing anything at all. But not having that plan makes things a little bit challenging compared to following a proven process. So let's dive a little bit more into each step. So step one, controlling your pain. This is addressing any immediate concerns. So figuring out, okay, is there any ligament tears? Is there any fractures? Anything like that that would, send you straight to the emergency room or something like that. After that all has been cleared, the focus is calming the irritation, getting things to settle down a little bit, reducing any kind of sharp pains that might be hanging around following the initial injury, and also addressing any major fears or concerns. Following any type of injury, I've been there too many times to count. There are going to be some fears, there are going to be some concerns. You're not going to feel great about things. So having those conversations, putting those fears to rest can do a really, really nice job of setting you up for success. And then also explaining why the body's on high alert. You just had an injury, so there's inflammation of the area. The surrounding tissues aren't quite sure what's happening. That's why you're having some of that pain. So treatment during this time might include some feel-good movements with intolerance. So gradually working on your range of motion, performing some very light exercises to turn some of those muscles back on. If you're seeing me in person, we might do some scraping, some cupping, dry needling, any of that stuff to just calm down the area and prepare your body to start to work on addressing some of those deficits. During this time, we also got to focus on education, timelines, and expectations. You'll know exactly how long this thing's going to take, what the course of progression should be. That's not to say you won't have some setbacks along the way, but making sure that you're very comfortable with what this overall process is going to look like. Once we get into step two, everything's calmed down. You're starting to be in less pain. We can start to focus on addressing what the root cause that even led you to this point is. So, some common deficits when thinking about the knee are just range of motion limitations. And these can be not only at the knee, but also at the ankle and the hip. This might include addressing some strength deficits like hip weakness and core strength weakness. But really, it's going to vary person to person. So, we got to figure out what led you specifically to having some of the injuries and some of the issues you're having. Treatment during this time could include improving your overall movement at the hips, knees, and ankles. We always look at the joints above and below whenever you're having any kind of an injury. And then also addressing strength deficits. So finding those areas of weakness and working to improve them so that this isn't an issue in the future. And then closing those gaps. So any of these deficits we find, it might be one side is having more of an issue than another. So we try and align those sides as closely as we can to each other and find those areas where you are having the issues so we can address them fully. Step three is conditioning the body. So we'll begin adding back in activities and sports that you really enjoy doing with a plan to progress. During this phase, we'll also start to restore your confidence and help you reclaim your life. So maybe you're a hiker, maybe you're a runner, a golfer, maybe you like going to the gym, whatever it is, we'll start to incorporate those activities back in slowly. Work on those movements you need to be able to do, put you in a position where you feel really confident getting back to those activities. Because the worst thing you can do is jump in too quickly and then have a major setback and start to get frustrated. So during this time, treatment is going to continue to work on your strengthening, but we'll also work on maybe you're a runner, cyclist. We might do like a return to run, return to bike program. We'll also be replicating any movements uh, needed to return to activities that you are wanting to. Step four, this is cementing your strength. This is coming back stronger than before. This is helping you avoid future injury. And this is achieving total confidence and understanding of your body. What I mean by that is, in terms of understanding of your body, you might have flare-ups in the future. You probably will. But having a game plan, having knowledge of what to do when those situations arise can be super, super helpful for you. Treatment during this time might include further improving any areas of weakness, might include exceeding prior levels of activity and performance. So, really starting to push the boundaries of what you thought your body was capable of and setting you up for a successful and exciting future. Because we know it's been a long time since you've been moving exactly how you wanted. Even if it's a couple weeks, I know that can feel like a long time if you're previously active. So quick recap here. Again, we talked about the active versus passive approaches. So always be asking yourself, what can I do right now to take control of my situation versus, okay, I'm just going to wait and see what happens, hope for the best. Traditional treatments often fall short. So if you've gone to a provider, even if you've gone to a physical therapist, maybe you're in a situation where you can only see them for 10, 15 minutes at a time, and then you're passed off to someone else. That's not a situation that's setting you up for success. So don't hesitate to seek out other providers, people who can give you individualized attention, and people who will take a close look at your situation and find the root cause, because there's a lot of good providers out there. So making sure that you're doing everything you can to take control of the situation early on and seek out those providers. Lastly, I want you to know, and I want you to take this to heart. You can absolutely take control of your health. You have all the tools within you oftentimes to heal yourself. Dialing in your sleep, working on your nutrition, finding movements that are comfortable, and consulting with people who can guide you, who can help you reach those health goals can be really life-changing. So I highly, highly encourage you to think about what you can do to take control of your health. because once you get in the mind frame of I can do this, I can make improvements, my future is not grim. Um, I mean, your overall outlook is going to just skyrocket, and you're gonna realize that your body's capable of a lot more than you originally thought. So, hope you enjoyed this presentation. Hope you were able to take a little bit away from it too, whether that's understanding your knee pain a little bit better, understanding your options, understanding why this cycle of knee pain continues. Whatever it was, I hope you found some value. Next steps I have for you, go ahead and follow me on social media at johnschaefer.dpt. I've got a lot of free content. I cover a lot of the same themes in terms of ways you can take control of your health, exercises you can be doing for your knees, and just different thoughts about overall health and wellness, because I think oftentimes we need those reminders. Subscribing to an account like this can be helpful. Next, feel free to subscribe to the YouTube channel. I'm posting weekly knee content to help you better understand your knee and to better work through your pain. And lastly, feel free to comment knee for a full guide of everything we covered today and also a step-by-step action plan to address your knee pain. So the worst thing you can do is watch this video and do absolutely nothing. If anything, or if nothing else, rather, I want you to just sit down and think about, where you're at in this overall journey, where you want to be, what you can do about it right now. Thanks for watching, and feel free to reach out if you have any questions or concerns. More than happy to chat with you.